Major developments, a global health emergency as the coronavirus reaches its 20th country. Good evening, I'm Steve Rabel.
I'm Monique Minglavin, and today new concern with the first case of the infection being passed from one person to another within the U.S. We now know a woman in Chicago gave the virus to her husband after she returned earlier this month from Wuhan, China. Now, her husband did not travel with her. He was put in isolation 2 days ago.
I recognize that this news may raise people's concern, but I want to state clearly that this development is something we have been prepared for.
The only way we will defeat this outbreak is for all countries to work together in a spirit of solidarity and cooperation. We're all in this together, and we can only stop it together.
To date, there are more than 7,800 cases in China, including 170 deaths. Now, this is only the 6th time the World Health Organization has declared a global health emergency. It was used before for Ebola and the Zika virus.
Here in Washington, 16 people were tested for coronavirus so far, but only one actually tested positive for the virus. He's getting treatment at Providence Regional Medical Center in Everett. KIRO 7's North Sound reporter Ryan Sims is live there tonight, and he begins our coverage. And Ryan, the question that so many people want to know right now, how's that man doing?
He has been here, Steve, for 9 days, yet doctors at Providence, they're not mincing words on what it's like to treat this man. They say he has been a star patient, so much so, get this, he is in the middle of a quarantine unit, yet every day they say he FaceTimes his family to update them on his condition. Tonight, more than 8,000 people have been infected with coronavirus across the globe. Of that total, the first person to be diagnosed in the U.S. is here in our own backyard.
He's been in good spirits. He's been communicative and extremely cooperative.
He's being kept in a part of the hospital originally set up to treat victims of the Ebola virus. Not that the coronavirus warrants the same level of caution as Ebola, not even close. Nurses say the protective clothing they're wearing to treat this patient demonstrates that.
So to start with, they put on a pair of very plain, these are just standard hospital gloves.
Tonight, Providence health workers tell us that man's treatment has gone even better than they originally anticipated.
When he first arrived, there was a nurse in the room with him almost constantly. And then we've since scaled down as he started to feel better.
So much so that they check on him only a few times a day. As for a release date, well, doctors say it all depends on certain guidelines issued by the feds, though they hope he'll be out of here within a week.
Viral infections typically don't require specific treatment other than Tylenol, fluids.
At the same time, a potential patient walked through the ER doors at Harborview yesterday. Tonight, containment has been set up there, and health officials are waiting on test results. But in another piece of good news, all 3 UW students that were being monitored have tested negative for the coronavirus. So that is the situation on the medical front, but as this whole coronavirus situation unfolds, there's also been a growing concern among the Asian community about stereotypes against them. And tonight at 6, we'll talk to healthcare workers about that. We're live at Providence Medical Center in Everett tonight. Ryan Sims, KIRO 7 News.
Meanwhile, more airlines are canceling flights in and out of China. And KIRO 7's Allison Grandi is live at SCA, where passengers are taking precautions. Allison.
Monique, we expect a flight to land here in the next 5 minutes or so from London. So we came here to baggage claim 1 and 2. This is the area where they're going to get their bags. We've seen a lot of people wearing masks here at the airport, but doctors say a better precaution you can really do if you're not sick is to wash your hands often. And if you don't have access to wash your hands, to use an antibacterial wipe like this, or to use some sort of antibacterial liquid to protect yourself from coronavirus. We watched the track and field team from Sacramento State arrive at SeaTac Airport, headed to a meet at UW, many of them wearing masks.
Yeah, I was scared. I was like, what kind of precautions do I need to take when traveling on a plane with a small space and a bunch of people around me?
It was up to each student to make the call. Amy Canones wasn't taking any chances.
It's mainly just for prevention efforts. We know there was a case here in Seattle. So we're just mainly trying to protect ourselves from potentially getting the virus.
Neither was Zach Blackwood.
So I wasn't worried about it, but just I just wanted to take another extensive measures.
While wearing a mask may be comforting, infectious disease specialists say most people get sick when they touch a surface and then their eyes and nose, transferring the virus. The Port of Seattle hired extra staff to sanitize bathrooms, railings, baggage areas, and anywhere international travelers pass through.
Every time I touch my seatbelt, I'll put hand sanitizer on. I touch a tray, I put the hand sanitizer on after. I mean, it's better to be safe than sorry.
While passengers arriving from China are being screened by the CDC, travel to and from China is about to be reduced. Delta announced it will cancel about half the flights to Beijing and Shanghai starting on February 6th, following the lead of United and American Airlines. Fear has dropped the demand. Mai Ha showed us her mask. She just got back from LA. She wore it on the plane.
To protect myself. I'm not sick, but I just want to protect myself.
And it isn't just travelers who we've seen wearing masks. We've also seen employees here at the airport wearing them. But we were told that one contracting company told employees they couldn't wear them. So we're looking into that to see what's going on here. Live at SeaTac Airport, Allison Grandy, Cairo 7 News.
The Americans evacuated from Wuhan on a charter flight will be monitored at a California military base for several days. Today we learned their temperature will be taken at least twice a day for the next 3 days. One of the evacuees describes what happened the moment they landed.
I've never seen someone in a hazmat suit before. And he was suited up. And on the plane, we got checked. And then 2 hours later, we got checked. And then another 3 hours, we got checked. All we wanted was safety for each other, to get home to our families and friends.
Well, this is our first video on board the plane. If doctors determine an evacuee has low or no risk of infection, they can go home, but will need to be monitored by medical professionals for a 14-day incubation period. The 6,000 passengers and crew aboard the Costa Smeralda can breathe a sigh of relief. They were just allowed to leave the ship after a sick Chinese national was diagnosed with the flu, not the new coronavirus. Everyone was quarantined near Rome, waiting for the test results.